got one.
Okay.
I'm so curious about the administrative side. And, I come into the hospital, I'm having a problem. I got run over by a car, I'm having an allergic reaction. I can give you my driver's license, or perhaps it's in my pocket, but if I do have one of those common names that 10% of the population have, and I do have one of those common birthdays, what happens? How do you sort of figure me out if you pull up my name and there's already 4 records on my name?
Typically the way it works in the hospitals, it's a standard practice. If the clerk cannot be confident that she has selected the right record or that she's going to select the right record, she will just create a new record. In that way, she's not selecting possibly the wrong one that might already exist. So she's better off starting a new record. That's the thought. The problem with that is that if you had been at that hospital before, you already have allergies on file, your meds on file, that is unknown for a period of time until such time that the back office can catch up and inspect your record and determine like, oh, there actually is another record for you. And they do this thing called record matching. And there's actually software, and I was a past product manager for this sort of software that all these hospitals have. It's called an Enterprise Master Patient Index. And it's actually many, many millions of dollars. And all it does all day long is sit there and look at the probability that these 2 records are for the same person. So that's how they do it, is they match based on demographics.
And I think the way to go forward, Pew from a research perspective has laid out a really good framework for deterministic patient matching, and it's 4 buckets. All systems and identity providers need to collect demographic data and authenticate users in a standardized way and to a common level of trust. And what you'll find right now is that hospitals do that differently. They'll collect different attributes. Some will collect your mom's maiden name. Some won't. Some will collect social. Some will only collect address information. If you don't have social, your address changes. They can't match. You get remarried or married for the first time. Maybe not remarried, but both. But your name changes, and now you can't be resolved to the same person because they don't have enough unique identifiers. So standardization is one important bucket that kind of overarches the other 3. The other one is demographic data, device data, your phone number, your device, and biometric data. And so to Josh's point, let's say you got mugged, your wallet got stolen, your phone got stolen, you were knocked out, and you showed up in an emergency room. The ideal would be that your face as a public identifier could resolve you to your patient records across systems. The problem is the facial biometric is not something that is universally collected or shared, nor do patients even have the option to say, hey, look, if I do show up in an emergency room, you can absolutely use my face to identify me. That would be a wonderful thing to enable, and the technology is there for it. So we kind of know what right looks like, but coordinating the entire system and getting everybody on the same page, it's almost like how do you build Visa in healthcare to get everybody credentialing folks the same way?